Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Sinus arrhythmia What's normal versus irregular? Sinus arrhythmia is a variation in the heart's sinus rhythm, usually caused by changes in a person's breathing cycle. It's a common finding, especially in children and young adults, and its presence often declines with age. Less commonly, sinus arrhythmia may indicate an underlying medical problem, like heart disease or heart block. /r/n/r/n The heart's normal sinus rhythm is created by electrical signals that spread throughout the heart in an organized manner along a certain route at a particular speed. /r/n/r/n This article explores sinus arrhythmia, including its cause, types, and whether treatment is warranted. /r/n/r/nIvanbalvan, Getty Imagesrnrn To understand the difference between normal sinus rhythm and sinus arrhythmia, it's best to start by exploring the role of an electrocardiogram, ECG or EKG, in diagnosing such rhythms. /r/n/r/n During an ECG, sticky patches connected to a machine by wires are placed on a person's chest, arms, and legs. The ECG machine then records the heart's electrical activity on a page of moving paper. /r/n/r/n The heart's electrical activity appears as a series of wavy, spiky lines. These lines are comprised of three main parts. /r/n/r/n In normal sinus rhythm, the PP interval, the time between consecutive P waves, is the same throughout the ECG. Also, the heart rate, how fast the heart is beating, is between 60 and 100 beats per minute, and the P waves are the same shape throughout. /r/n/r/n In sinus arrhythmia, the PP interval is slightly varied by 120 milliseconds or more. Like normal sinus rhythm, the heart rate is still, usually, between 60 and 100 beats per minute, and the P waves are the same shape throughout. /r/n/r/n Even though the PP intervals are slightly different in sinus arrhythmia versus normal sinus rhythm, the irregularity has a pattern associated with the natural breathing process. /r/n/r/n The three types of sinus arrhythmia are /r/n/r/n Respiratory sinus arrhythmia occurs when the heart rate increases with inspiration and decreases with expiration. /r/n/r/n The vagus nerve, a vital component of the parasympathetic nervous system, mediates this pattern change in heart rate during the breathing cycle. /r/n/r/n The parasympathetic nervous system is part of the autonomic nervous system, and the sympathetic nervous system is the other part. /r/n/r/n Unlike the sympathetic nervous system, which is responsible for the flight-or-fight response, the parasympathetic nervous system controls the body's ability to relax, what's known as the rest and digest response. /r/n/r/n Interestingly, due to the vagus nerve connection, research suggests that respiratory sinus arrhythmia may be a marker of parasympathetic regulation, specifically emotional regulation and stress response. /r/n/r/n In most cases, sinus arrhythmia is harmless and not problematic. However, if a person is experiencing symptoms or is taking certain medications, for example, digoxin for heart failure or atrial fibrillation, further testing is necessary. /r/n/r/n Respiratory sinus arrhythmia is usually an incidental finding on ECG and does not cause symptoms. /r/n/r/n Non-respiratory sinus arrhythmia may be associated with symptoms if heart problems or digoxin toxicity are present. /r/n/r/n Possible symptoms of heart problems include /r/n/r/n Possible symptoms of digoxin toxicity include /r/n/r/n Nearly everyone with ventriculophasic sinus arrhythmia related to complete heart block has symptoms. They may include /r/n/r/n Respiratory and non-respiratory sinus arrhythmia appears on an ECG as the following: /r/n/r/n. The critical distinction between these two types of sinus arrhythmia is that in non-respiratory sinus arrhythmia, the variation in the pp intervals is unrelated to a person's breathing. /r/n/r/n. Other diagnostic tests potentially used to assess for heart problems or digoxin toxicity include /r/n/r/n. Ventriculophasic sinus arrhythmia from complete heart block means no electrical impulses from the heart's atria reach the ventricles. So, an ECG will reveal the following: /r/n/r/n. A complete heart block has many possible causes, so several diagnostic tests, including many of those mentioned above, are used. /r/n/r/n. Possible causes of complete heart block include /r/n/r/n. Sinus arrhythmia is a normal phenomenon when associated with the breathing cycle. No further evaluation is needed. /r/n/r/n. If the sinus arrhythmia is unrelated to the breathing cycle, an investigation into underlying causes may be performed, such as if a person has symptoms or is suspected of having a diseased heart. /r/n/r/n. Finally, ventriculophasic sinus arrhythmia from a complete heart block requires immediate attention in a hospital setting. /r/n/r/n. Depending on the person's stability and whether the cause is reversible, treatment may involve intravenous, medicine, temporary heart pacing, and/or the placement of a permanent pacemaker. /r/n/r/n. Adopting the following lifestyle behaviors can help optimize your heart's functioning and prevent the development of a diseased heart or dangerous arrhythmias like heart block. /r/n/r/n. Sinus arrhythmia is a variation in the heart's natural rhythm, usually caused by changes in the breathing cycle, what's known as respiratory sinus arrhythmia. /r/n/r/n. Respiratory sinus arrhythmia is common in children and young individuals with a healthy and well-functioning heart. It's a normal, often incidental finding that is not associated with symptoms and does not require further evaluation. /r/n/r/n. Conversely, two other types of sinus arrhythmia, non-respiratory or ventriculophasic sinus arrhythmia, require a careful and thorough workup and evaluation, as heart or other medical conditions may be present. /r/n/r/n. Seek medical attention if you or a loved one is experiencing potential symptoms of an abnormal heart rhythm, such as lightheadedness or palpitations, racing, pounding, or fluttering heart. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.